Hello everyone, I Assistant Professor V Shete from Department of Microbiology, KJ Somaiya College. In the last online lecture, we have started the study of the rabies virus, right? We have reached till the pathogenicity and the egg cultures and the tissue cultures cultivation till that, right? In this online lecture, we will study about the pathogenicity and the pathogenesis. Okay. First, I will tell you about the pathogenicity. Okay. Now, in the pathogenicity, the rabies virus can be said to be most pathogenic virus. Okay, and the humans are the natural host of the rabies. Right? Humans and all the mammals. The virus present in the saliva of the animal is deposited in the wound. Okay, if the infected animal got bitten, okay, if they bite on human, so that through the animal saliva, the infection can be spread, the virus can be spread, or in case if the human is already has some wounds, so by that way the infection can also be spread. Okay, then rarely the infection can also occur through the non-bite exposures, such as I am mentioning, the if a wound is already present, then that can be exposed to such as by licks or the aerosol or by the corneal transplantations. Okay, then the virus appear to multiply in the muscles, connective tissues and the nerve at the site of the deposition for 48 to 72 hours. The incubation time is between 48 to 72 hours of this virus. Okay, then what will happen, then it will penetrate the nerve endings. Okay, right now we are discussing the pathogenicity of the rabies virus. Okay, the pathogenicity, that how pathogenic is the virus, which are the host, okay, what are the modes of the transmission, all right, that we have saw. Okay, then the virus penetrate the nerve ending and the travels in the exoplasm. Exoplasm is present in the spinal cord and the brain. Okay, so it will move in the exoplasm, and the movement of the virus in the axons, we all know the neurons and the axons, right? So exoplasm in regard with the axons. Okay, then the movement of the virus is in the axon is passive at a speed of about 3 millimeter per hour. Okay, the virus will travel 3 millimeter per hour in the axons, in the exoplasm, right? Then the infection spreads from axon to the neurons, the neuronal bodies. Okay, then it can also multiply in the salivary glands and can remain shades in the saliva, protected in the saliva. Okay, and in case of the human, the incubation period is the 1 to 3 months. The previous one, that is the axons to the neurons, it is in the animals. Okay, the mode is the same, only difference is in the incubation period. Okay, the virus will travel in the same way, only the incubation period will differ. All right, that is about the pathogenicity. Okay, important points in the pathogenicity are what, that the mode, the host, which are the host are the more pathogenic, right? Now the humans and the animals. All right, then it can transmit by bites, animal infected animal bites, or by licks, or by corneal transplantations, right? Then aerosols. All right, and the incubation period for animal is 48 to 72 hours, and in the humans incubation period is 1 to 3 months. Okay, Now we will come into the pathogenesis of the rabies. Now you can see in this slide, right, there are the steps for the pathogenesis, how it is proceeding. Now first is the exposure, right? For any infection to happen, what will be the primary exposure to that pathogen, to that virus? Therefore, the first bite from the rabid animal. What is the rabid animal? I have mentioned in the earlier class. Rabid means the animal with the rabies virus. Okay. Rabid animal infection with the virus, and therefore the exposure will then takes place, right? And due to exposure, now the virus will get entry to the host cell, host body. Now there will be the incubation period in which the virus will multiply and will increase its yield, right? That incubation period is for 20 to 90 days. Okay. Then the first symptoms. Now in the first symptoms, the virus will spread into the CNS. Why? Because the site of the infection is the CNS of the rabies. Okay. What is the primary function, or what is the primary terms in the rabies disease infection? It will cause the encephalitis, that is the inflammation of this brain, right? Therefore the virus will reach to the central nervous system, okay, in the first symptomatic stage. Then we will come to the prodromal stage. Prodromal stage is having the 2 to 10 days. This stage will remain 2 to 10 days. Okay. Then this stage, the symptoms will appear such as the normal symptoms, the flu, then the headache, fever, malaise, then the paresthesia. Okay. These symptoms can be present at the prodromal stage. Then the stage will come for first neurological sign. Now what are the neurological signs? The brain dysfunctions, right? Because there is the inactivity or the disability of the neuronal activities, right? That is called as the neurological signs. Now that will include the cerebral dysfunction, right? Then anxiety, confusion, agitation. Okay. Then what is the next? Acute neurological phase. It will remain for 2 to 10 days. Okay. And the symptoms in this stage, in this phase, it will be, now it is the more harmful, right? It is the acute neurological phase. Now the symptoms can be the progression to the delirium, which is the part in the brain, then abnormal behavior of a person or of a host, then the hallucinations, insomnia, hydrophobia, aerophobia, and the photophobia. These are important characteristic symptoms of the rabies infection. Okay. Then what will happen? The onset of coma for 0 to 14 days after the acute neurological phase. The host will goes under the coma stage. Okay, and after that, we know after the coma, the most probable possibilities are for the death of that host. Okay, then the ending will be the death of that host, and that is why this virus is very much harmful, right? It is fatal disease or the fatal infection causing virus. Okay. Now this is the pathogenesis and the pathogenicity of the rabies virus. Now we will see the clinical diagnosis, that is the clinical stages or the clinical features, symptoms of the virus. Now symptoms are also similar way, as I have mentioned, we have discussed in the earlier slide. First is the prodromal symptom. Okay, that is the non-specific symptom, prodromal symptoms. Why these are non-specific? Because these are the common symptoms, right? Such as the flu, then the fever, headache, and that is why we are calling it as the non-specific symptoms. Okay. Now this include the sore throat, fever, headache, anorexia, nausea, vomiting, right? Depression. These are the non-specific symptom. Then second stage we are having the acute neurological encephalitis. Okay. In this what will happen, as we discussed in the earlier in the pathogenesis, in this the virus will reach to the central nervous system, right? And therefore the symptoms will be the confusion, the agitation, the hallucinations, then dysfunction of the brain. Okay, these symptoms will be in the acute neurological encephalitis. What is encephalitis? Inflammation of the brain. Okay, then the muscle spasms, meningismus. Okay, then oxytotonic posteric mental aberration. These are some symptoms of the acute neurological encephalitis. The important one can be the excessive motor activity, that is a dysfunction, then hallucination, confusion, and the agitation. Okay, then again we have the third one, that is the coma stage, and the fourth one is the death. Okay, now we will see the laboratory diagnosis. In the laboratory diagnosis, what will be the first step? As we have discussed in the earlier lectures, the first step will always be the specimen collection, right? Now which specimen or which samples we have to collect for testing the rabies virus? The brain, the cerebrospinal fluid, or the brain post-mortem samples we can take. Okay, then corneal smears we can take, or the skin biopsy. Okay, the skin, the wounds, that we can take. All right, now after collecting the samples, now we will look for the viral presence in the sample, and that we will carry out using the two methods. In the direct microscopy, there are the two methods called as the antemortem and the postmortem. In the antemortem, it is the method, okay, it is the name of the method, and which is most commonly used for diagnosing the rabies virus antigens. Okay, it is used to diagnose, it is used to determine or detect the presence of rabies virus antigens with the help of the immunofluorescence method. Okay, now it is a type of direct immunofluorescence, and which can be done using the monoclonal antibodies. These antibodies are tagged with the fluorescence molecules. This we have discussed on the earlier lectures also, right? Then if the virus is present, what will happen? The fluorescence will happen, right? If the antigen antibody complex will be formed, then the fluorescence will emit in the positive reactions, right? Then the next is the post-mortem. Then in the post-mortem, in the brain, we will be looking for the nectary bodies. Okay, as we know now, these bodies are the intracytoplasmic inclusion bodies, right? These are the composed of the febrile matrix. Okay, this we will look into the brain, and with the help of this post-mortem. Okay, now the third one will be the animal isolation. Okay, in the animal isolation or the viral isolation, will be using the animal and the tissue cultures. Okay, then in the animal we will be doing it with the mice. Okay, we can isolate in the mice, and the samples can be CSF, saliva, brain post-mortem samples. Okay, or the brain surgery samples that we will use. All right, then tissue cultures. In the tissue cultures we have discussed this also. The tissue cultures such as the continuous tissue culture cell line, okay, is most commonly used. Then the third one is the antibody demonstration. Now, as we all know, in the each disease or in the each dysfunction, our host body, our immune system will defense against that pathogen and produce the antibodies against that, right? Now that antibodies can be determined using this antibody demonstrations, all right? Now the high titer of these antibodies are present in the CSF, okay? Then that can be determined using the ELISA test, okay? We know what is ELISA. It is the antigen antibody reaction, right? That can be used to determine the antibody titers against this rabies virus, okay? Then molecular method we can use, such as the RT-PCR, reverse transcription PCR, okay? That we can use, right? Now one important point in the laboratory diagnosis, that is the, if we have to diagnose an animal, okay, that is the, say, dog or a cat, if it is infected with the virus, then how we will diagnose it? We will do the brain surgery. We will take out the brain of that virus, of that animal, and then 50% of that we will distribute it, remove that brain very carefully, okay? And we will the two portions, the one portion of the brain in the 50% glycerol saline and the others in the Zinker's fixative will be sent for the biological testing and microscopy and the antibody demonstrations in the animals, okay? In case of the humans, see, we are taking the samples, as we have mentioned, CSF, okay, and the saliva or the corneal swabs, all right? And the animal, we can remove the brain very carefully, okay? And then we will look for the presence of the negri bodies. See, if the, in the sentence, the brain surgery or the post-mortem of the brain will come, then first thing should come into your mind is the negri bodies, okay? Because these are present only in the brain, in the CSF, okay? Who are they? The negri bodies are the intracytoplasmic inclusion bodies, okay, which is a very distinguished characteristic of this rabies virus. This bodies will contain this matrix plus the rabies virus, okay? Then for determining these negri bodies, there is one small staining technique that is available called as the Seller's technique, okay? In this technique we use the basic fuchsine and the methylene blue, okay? Now these bodies can be the 3 to 27 mu meters, right? This is the laboratory diagnosis of the rabies virus, okay? One important difference in the animal diagnosis, what are those? The brain we can remove carefully in the case of the animals, okay? This is the laboratory diagnosis of the rabies virus. Now we will look into the prophylaxis of the rabies, okay? In the prophylaxis, as we have seen this earlier, the first vaccine, successful vaccine for the rabies was made by the Louis Pasteur, okay? And he made this vaccine by the drying various pieces of the spinal cord of rabbits infected with the fixed virus. Now one thing important to note down here is the vaccine was made with the fixed virus, not street virus. What is the fixed virus? We have saw in the earlier lecture. The fixed virus is the one who is passaged frequently so that its activity is getting stabilized. It is stabilized virus, It is made in the laboratory, or it is achieved in the laboratories. Okay, which is complete opposite of the street virus. Street virus is the one who we isolate naturally from the natural host. If the dog is infected with the virus, then if we take isolate from the sample, from that dog sample, then that will be the street virus. Okay, and which activity is very unstabilized or very active virus in that. Okay, in case of the fixed virus, we have discussed this point also, that the virus is also used for preparation of the vaccines, right? And this is the very good example of that Louis Pasteur has been made a successful first vaccine with the fixed viruses. Okay, and that vaccine in the 1885 was injected in a 9-year boy, okay, named as the Joseph, and the 13 injections were given to him, and he was saved due to these vaccinations, and therefore then it has been used widely. Okay, then in the prophylaxis we have two types: pre-exposure and the post-exposure. Pre-exposure means what? Before the exposure of this infection. Now, what measures or what preventions we can take? So in this, the specific prophylaxis of the pre-exposure is in animal, the immunization can be done, right? The vaccination of the animals, as I have mentioned in the earlier lecture also, the vaccination of the animals is very much important, so that they will not get the virus. Okay, right. Then the post exposure prophylaxis. In that, prophylaxis are used after the exposure to the infection. Okay, that is why calling as the post, right? Post exposure. And this is also can be called as the anti-rabic treatment. Okay, see, anti-rabic against the rabies. That is why the post exposure of the rabies can also called as the anti-rabic treatment. Okay, now this will contain the local treatment. Okay, then local treatment is this. You can see in this picture the wound cleaning. That is as soon as we get a bite from that infect or any animal, it's our first duty to clean that space, that area with the water. Okay, then we have to put the antiseptic creams, right? We have to wrap it with the proper bandage. Okay, that is our foremost step should be. All right, then now we have the different vaccines, anti-rabic vaccines. Okay, in that the neural vaccines, then the non-neural vaccine. All right, before coming to the vaccines, there are some more important points in the local treatments. Okay, now as I have mentioned, we have to wash that area thoroughly with water and the soap. Okay, then we have to treat that with the iodine or the alcohol, which is diluted, 40 to 70% diluted alcohol. Okay, and then anti-rabic serum can be applied to that wound. Okay, then we can take the antibiotics to prevent the sepsis. Sepsis means what? The blood infections. Now the wound is present, so the bacteria can adhere to there, right? Therefore, that is called as the sepsis. So we can prevent them by taking the proper antibiotic medications. Okay. Now we will come to the vaccination part. Now we have the two types of the vaccine, neural and the non-neural, and the egg vaccines, right? Now in the neural, there are the suspension of the nervous tissues of the animals. This neural vaccines, these are the suspension of the nervous tissue of the animal which were infected with the fixed rabies virus. See, the vaccines are always made from the fixed virus. Why fixed virus? Because it is stabilized. Its activity of that virus is stabilized, right? How we achieved, or how we can occurred this fixed virus? By frequently passaging to the animals, right? This fixed virus is achieved in the laboratories. It is not naturally present. Okay, which virus is naturally present? Street virus. And the vaccines can be made from fixed virus. Why? Because it is stabilized. Alright. Now therefore the neural vaccines will contain the suspension of nervous tissues of the animal, okay, which containing the fixed virus. Okay. Now this vaccines now have been used in worldwide, okay, and which are available at an affordable cost. Now in the neural vaccines also we have three different types. First one is the sample vaccines, then the beta propiolactone, that is the Bpl vaccine, and the suckling mouse brain vaccines. Now coming to the first one, that is the sample vaccines. This vaccine is developed by the sample. That is why the name called as the sample, SAMPLE. Okay. Now this vaccine is containing the 5% ship brain suspension. Okay. The sample vaccine will contain the 5% ship brain suspension. Now the second one, that is the beta propiolactone, that is the Bpl vaccine. This is the modification of that sample vaccine, okay, in which the beta propiolactone is used as the inactivating agent instead of the phenol. See, these are the live attenuated vaccine, okay, which means the virus is inactivated in these vaccines. Alright. In case of the sample vaccine, the 5% suspension of the ship brain serum, ship brain fluid, okay, and that was inactivated with the phenol. And now in the Bpl vaccine, that is the little modification in that sample vaccine, in which it is also having the 5% suspension of the ship brain, which is inactivated with using the beta propiolactone. Okay. Now why this has been used? Because it is more antigenic, and that is why very small doses of this Bpl is required, are very sufficient enough. Okay. Now the third one, that is the suckling mouse brain vaccines. Now in this, the encephalotogenic factor in the brain tissues is the basic protein associated with the myelin. We all know the myelin tissues, right? Now the encephalotogenic factor in the brain is the myelin. Okay. Now the vaccines are developed using the mouse or rat or the rabbit brain. Okay. In this also the brain tissues are there. Infant These vaccines are developed using the infant mouse or rats or the rabbit brains. Okay, this is the suckling mouse brain vaccines. All right. Now the second one, that is the non-neuronal vaccines. In the non-neuronal vaccines, we having the first one is the egg vaccine. In the egg vaccine, first is the duck egg vaccine and the live attenuated chick embryo vaccines. Now we have discussed that's the duck egg vaccine. Why? Because we get larger yield of that virus if we cultivate that virus in the duck yield tissue cultures. Okay, duck egg cultures. That is why we can use the duck egg vaccine. Okay, and this is the purified version of that vaccine. Now the second is the chick embryo vaccines. In that also, the two types of the vaccines are developed with the flurry strain of the chick embryo, which are those low egg passage and the high egg passage. Okay, now the low egg passage, that is the LEP vaccine, which is at the 40 to 50 egg passage level for the immunization of the dogs. Right, which means the 40 to 50 eggs were used for this passage of that virus for the cultivation of the repeated cultivation. And in the high egg passage, the more number of the eggs, okay, the vaccine at the 180 passage level for the cattle and the cats. All right, in the LEP 40 to 50 eggs, in the high egg passage 180. All right, this vaccines although these are not in use for now. Okay, then the tissue culture vaccines. Now the vaccine, the first cell culture vaccine was made with the human diploid cell cultures, HDC. Okay, human diploid cell, called as the HDC, which was developed by the Koprovsky, Victor and the Plotkin. Okay. So basically it is grown with the cell culture of the human diploid cell. That is why we are calling as the HDC vaccines. These vaccines are available in the India. And along with the HDC, the purified chick embryo cell vaccine is also used very widely, and the purified viro cell is also used, that is the PVC. Okay, so these are the three vaccines currently that are available for the immunizing against the rabies, which are those HDC, PCEC and the PVC. HDC, human diploid cell vaccine, PCEC, that is the purified chick embryo cell vaccine, and the PVC is the purified viro cell vaccine. Okay, now we have the fourth type, that is the subunit vaccine. Now what is the subunit? The glycoprotein subunit that is present on the viral structure. Okay, and as we know that this is the protective antigen, and that is why can be used that as the protective antigen, therefore we can use this for producing the vaccines, right? The production of the vaccines. Okay, and this glycoprotein can be cloned and recombinant vaccines can be produced. Okay, although these vaccines are not came into the market till date, these are in the experimental process. Okay, the subunit vaccine. Which are the vaccines that are available now? The HDC, PCEC and the PVC vaccines are available. Okay, and the neuronal vaccines, in the neural vaccines, the Bpl and the suckling mouse brain vaccines plus the sample vaccines. Okay, in the non-neural vaccines, egg vaccines and the tissue culture vaccines. In the egg vaccine, duck egg and the chick embryo vaccine. Okay. And in the tissue culture vaccines, the HDC, PCC and the PVC. Okay. And also in case of the chick embryo vaccine, there are two, the low egg passage and the high egg passage, right? This is the prophylaxis of this rabies. Now passive immunization, there is the vaccines that we can also take. These are the ERIG and the HRIG. These two vaccines that we can, these are not the vaccines basically, these are the globulins. Okay, these are the serum, okay, that can be prepared or can be manufactured by the hyper immunization of the horses. Okay, the ERIG, that is the equine rabies immune globulin, antibody against this rabies, which can be achieved or which can be manufactured from the horse antibodies. Okay, now the horse is hyper immunized with that rabies, therefore it will produce this antibodies. Okay, that is the equine rabies immune globulin, ERIG. Okay, then the second one is what, the human rabies immune globulin, that is the HRIG. These immunoglobulins are costly and present in very limited amount. Okay, and these vaccines are more preferred than the previous, that is the ERIG. Why? Because it is free from any danger of the sensitization. Okay, but while manufacturing or while preparing this vaccine, we should take care that the person is not having any other disease such as the HIV or the hepatitis viruses. Okay, that can be transmitted through the serum. All right, that is why we have to make sure that things. Then the recommended dose for this vaccine is 20 immunizing units per kg of the body weight. Okay, and in case of the drugs or any antibiotics or the medications that are not available till date, we have the vaccines available. Okay, still now, as we know, if we get a dog bite, then we have to take a lot of injections, right? So these are those only. Right? Then there are the vaccines for animals also, which are very much essential, and that can be the concentrated cell culture vaccine. Okay, which gives the good protection after the single injection, and that injection will be the intramuscular injection. Okay, now that injections can be given at the 12 weeks of the animal, 12 weeks of age, and repeatedly at 1 to 3 years of the intervals. 12 weeks, after 1 year again, or after 2 years, or after 3 years again. Okay, these are the vaccinations. This is the vaccine part of this rabies, right? In this online lecture we have studied the pathogenesis, right? The pathogenesis of this rabies virus. Then we have studied the clinical features, clinical symptoms, the pathogenicity. Okay, then we have saw the prophylaxis, pre-prophylaxis and the post-exposure prophylaxis. Okay, Then we saw the vaccines, anti-rabic vaccines. In the anti-rabic vaccine, we have studied the neural and the non-neural. Neural vaccine, non-neural vaccine, subunit vaccine, and the the three types of the vaccines. Okay. Then we have saw the passive immunization. What is a passive immunization? These are the immunoglobulin. Okay. Equine rabies immunoglobulin and the human rabies immunoglobulin. Okay, the first one ERIG is obtained from the horse, and the second one is from the human, and the second one HRIG is the most preferred. It is more costly and it is present in the limited amount. Okay, now there are vaccines available for the animals also, right? Now the animals, the vaccine should be the 12 weeks of the age and should be repeatedly dosage after 1 to 3 years, right? Then in case of the treatment, so that is the antibiotics or any medication, so that is not available. All right, we have the vaccines with us, so it's our responsibility to take the vaccines and to give our pets this vaccine so that they will not get infected with this virus. Okay, I hope you understood this online lecture. If you have any doubt regarding this, please ask in the comment section. Thank you for watching.